As healthcare professionals, we all know how important good diagnostic and treatment skills are in providing clinical care, and using good communication skills is equally important in providing patient-centered care. We use communication skills in having conversations with patients and their family members and caregivers about ways to stay healthy and prevent the chronic diseases that often come as folks get older. Shared decision-making is a process that uses good communication skills in having these kinds of conversations with patients.
I was never trained in how to help someone make a decision in a shared way. I was trained to give the patient the information, they'll make the choice, or if you're more patriarchal, you make the choice and tell your patient. The process of really learning a new way to communicate and to explore together the options and to help each other, where the clinician brings their expertise and the patient brings who they are and their values, together the best outcome usually happens.
The shared decision model is all about facilitated discussion. And the beauty of this model is that it's intended to engage the veteran, their family or caregiver, and the full team that works in support of that veteran's healthcare and long-term support service needs.
To me, the shared decision-making is a collaborative process where the patients actually make the decisions based on the input and guidance that is provided by the healthcare professionals in their team. If you remember, in the older days, or even in current practice in many places, oftentimes the team members will tell the patients what is best for them in a certain given setting. I think that is not the preferred way of, frankly, having the patients be involved in the decision process. I think the best thing is to let them tell us what their needs are, what their preferences are, and then for us to then recommend to them what are the options, and from those options they can make a decision and they can tell us what they would like to do.
Shared decision making is really about peeling the layers away from the decision facing the individual to really discuss what matters to them, what's important to them, what the choices are that they're facing, and together coming to a way forward.
Geriatrics and extended care is a general term for a broad spectrum of services that are provided. They're long-term services and supports for veterans who are no longer acutely ill, but who require services and supports to be able to maintain their highest level of quality of life and daily living that is possible. So we try to assess the need of the veteran for extended services, and then work with the veteran and possibly whoever is the veteran's representative, support person, spouse, whomever the veteran chooses, to try to provide the services in the venue that best meets the veteran's needs.
Most people don't have much familiarity with long-term services and supports until they are confronted by the need to learn about them, either because a loved one is facing it or because they themselves are no longer able to live independently. And for that reason, most individuals need to be educated about what the choices are.
Decisions about long-term services and supports are best made using a shared decision-making approach. These are the kinds of decisions that don't have just a one-size-fits-all answer for everyone. So it's really critical to use an approach that brings in both the clinical information and the personal preference and feelings of the veteran and their caregivers.
I really believe that in terms of non-institutional long-term care, shared decision-making is something that is critical because of the fact that we're talking about the veteran ensuring that we're meeting their needs, ensuring that we're meeting what's important to them and to their families, and providing them with that care and the support that's necessary.
I think long-term services and support is a whole domain where the personal aspects of care and life are so central to every decision made. It's not like somebody gets rolled into the emergency room and has acute appendicitis and, we don't need to make a lot of shared decisions if you agree I need to take out your appendix, But in the circumstance of long-term care, these are much more personal decisions. And if we don't partner fully with the individual and their caregivers, we're not going to get to the best or most optimal path for that person.
The shared decision-making model encourages quite a holistic approach to caring for the veteran. And so what I really like about this model is that it's not just about what the VA can provide for that veteran, but it's what the VA and the veteran and community provision of support services may be possible. And so when we think about there being a connection with community agencies, local support services, and the VA, we're really talking about bringing all aspects of resources to bear into that veteran's life. So I think the shared decision-making model reminds us that it's okay to go outside of our silo and to really think holistically about the veteran and his or her family.
Our motto is that we really honor veterans' preferences and that we work towards their goals of care, both in our hospice and palliative care programs as well as in our other programs such as home-based primary care. And we really want to honor those goals of care and focus on that as opposed to deciding for them.
And a fundamental principle of geriatrics is not really on the cure of diseases that affect older individuals, but optimizing the accommodation to those chronic diseases. And at its heart, that's what shared decision-making is about. It's about making sure that decisions of lifestyle and healthcare measures are consistent with what an individual really wants done for them today, tomorrow, and in the future, as opposed to the more traditional healthcare approach, which is you have a disease, we have a cure, we'll put them together, we'll take care of your problem.
Well, shared decision making is very important all the time, but when you're talking about a condition which is apt to lead to the death of the patient, we have a situation where emotions come to the fore. American medicine has been very scientifically based for the past 100 years, and that's brought some very great strides forward in the delivery of medical care. But we need to now emphasize a little bit more the humanity, which is the values that the patient has and their desires.
I think that anyone who works with older individuals or individuals who are likely to benefit from some assistance in making difficult decisions would find not just the tools, but the underlying philosophy that's embodied in the shared decision-making module to be of enormous assistance, not just with the patient sitting across from them during an interview, but in their clinical practice going forward.
Educating the veterans is becoming easier through the shared decision making and through the long-term care guide that's on the website currently. So we're very fortunate to have had that implemented, and we've been working very diligently to make sure that all of our services are on there and all of that is up to date and current. And we have been receiving a lot of feedback on that website about how our programs operate and how veterans are receiving that very well.
The guide is an amazingly comprehensive collection of different materials and resources that providers and other advocates for the veteran can draw on to ensure that every reasonable effort has been taken to elicit and then reflect and communicate back the patient's preferences given their current state of mind.
The self-assessment worksheet for the caregiver is so powerful, and we rarely look at the effects of these decisions on the caregiver. And that assessment really helps set up some quality care to support the entire care network around the veteran. Where in healthcare do we slow down enough to actually look at what are the needs of the caregiver? And this assessment, I think it almost gives the caregiver permission to say, yes, I'm stressed, I'm tired, and that checklist provides those crucial questions for them to think, and it so normalizes for them what they might be going through. The shared decision worksheet for the veteran is also another really exciting tool because it's a beginning point for the social worker to start that conversation with the veteran and their care partners in what are your values and beliefs and desires in your long-term care planning. It's a beginning point, not an end point.
Recently, within patient care services, I've actually engaged in conversations with several chief consultants in primary care, in specialty care services, mental health services, and they're all talking about implementing shared decision-making process in their areas. When I recently heard about long-term services initiative in shared decision-making, I feel that this could really serve as a model for implementation of shared decision-making process within these different consultative services in patient care and also within VHA.
As we move forward with shared decision making, I would like to see social work take the lead on it and really adopt shared decision making as a process and framework for us to help veterans make their long-term care decisions. And this is something truly, shared decision making should truly be implemented within every VA healthcare system nationwide.
One of my reflections as a physician, as someone trained as a physician, is that often the process of shared decision making is best when it's in and of itself is shared, when the actual process is shared. And there are a lot of folks that are usually, typically, even more skilled than physicians are in this kind of conversation. And it aligns beautifully with care managers and social work and many, many of our colleagues who are comfortable and trained and skilled and practiced at having this kind of conversation. The whole team can benefit when the shared decision making isn't just shared between the clinician and the patient, but the team and the patient and the patient's team, their family.
I do truly believe that it's not something that's just policy, but it's actually something that helps us with our cultural transformation and not only improving experiences, but outcomes for our patients, and having that collaborative, the collaboration and the partnership that I think is necessary for what we are trying to achieve within VA and healthcare overall. Truly, shared decision making is a way of practice. It's a culture, and that's the best way that I can state it.